On this day of May 28th, the International Day of Action for Women's Health in our motherland, Uganda, COVID-19 pandemic is continuously hindering women of reproductive age, especially from the community grassroots levels of Uganda, from accessing comprehensive sexual reproductive health services due to lack of transport, lockdown, fear of contracting the coronavirus, lack of money to pay for the services, lack of health service providers, to mention but a few. As women of reproductive age are still battling with fear of COVID-19 pandemic, the need for access to comprehensive sexual reproductive health services, leave family planning, comprehensive abortion care, maternal health care services, to mention but a few, are mushrooming, especially among women of reproductive age from the community grassroots levels of Uganda. As the world commemorates this year's May 28th, the International Day of Action for Women's Health, the country representative of UNFPA in Uganda, Alain Sibenala, expresses concern that access to contraceptives and other related sexual reproductive health services has been made inaccessible due to the ongoing lockdown, and this is likely to affect Uganda's population growth.
As it's estimated by UNFPA that during this lockdown, 2 million women have not accessed family planning methods, and that if this continues, it will result to 7 million women having unwanted pregnancies. Those who may result into termination might use it and in unsafe way, which might also lead to loss of lives, but at the same time sustaining of lifetime injuries amongst these women of reproductive age.
Richard Kabanda, Commissioner in charge of Health Promotions, Education and Strategic Communication in the Ministry of Health, indicated that there is a campaign that is about to be introduced to sensitize women.
That's why we are running this kind of campaign across the country, to be able to mitigate some of the risk behaviors, but also let the public know that it's better for them to plan better for themselves as individuals, but also for the future. The future of parents or the would-be parents, but also for those, but also for their children.
Yigam Musa, the team leader for COHERINET, a non-government organization, has the same concerns despite the COVID-19 lockdown.
We are calling upon like-minded organizations for an amplified voice to call upon our government to ensure that there's easy accessibility and availability of comprehensive sexual reproductive health services, not limited to comprehensive abortion care services for women, especially those from the grassroots level communities.
Despite this lockdown, the Community Health Rights Network, we have continued to provide free and reliable information on sexual reproductive health and rights, not limited to safe abortion information. And we have also referred women for services despite this lockdown. We continue pledging to provide services and information to women and girls from grassroots communities.
The Archbishop of the Anglican Church, Dr. Stephen Kazimba Mugalu, has preached through his televised sermons that women should not make mistakes, but make sure they access reproductive health services.
However, as we are in this pandemic, women should not forget about family planning. May I support it?
Dr. Simon Peter Kayondo, a senior gynecologist and member of the Association of Obstetricians and Gynecologists of Uganda, says the government needs to be considerate to women and girls when issuing orders and guidelines.
Unfortunately, those measures, whereas they assisted with preventing the spread, they sort of sabotaged the gains that we had made in maternal health.
Findings show that Uganda's targeted population is set to hit over 50 million people by 2025. However, should access to reproductive health be restricted, there are worries that this number may be higher than this. The Community Health Rights Network, COHERINET, through the Aunt Kachi toll-free helpline, is however trying, though still finding many challenges.
During this lockdown, the Anti-Kaki department has continued to provide free, accurate, and reliable information on sexual reproductive health to women and girls in the grassroots communities of Uganda. We are also proud to have referred many girls and women in need of sexual reproductive health services to our friendly facilities.
If health is crucial, there should not be a lockdown on women's health rights.